Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. These questions are all about vaginal odor. Question number 1. What is the normal vaginal smell? Please explain. So, the vagina has a natural smell. Everyone's is going to be a little bit different. And for some people, it can even change a little bit with different foods. Not for everybody, but some people notice a change when they eat different things. But the odor is going to usually reflect what the normal environment is of the vagina, which is an acidic environment. We also have natural yeast and bacteria that can live down there, so their byproducts can also create a little bit of a smell. So smells that go along with that type of environment would be more of like a vinegary smell, even a slight fishy odor can be normal, and that's because of your vaginal environment and the healthy space that your body creates there. So it can inflict a little self-consciousness, but try not to feel bad about your vaginal odor. Your body's doing a lot of work down there. Question number 2. Can having an infection cause your vagina to smell bad? Yes. So when you have an infection, you might notice a shift or a change in your vaginal smell. And this could be a sexually transmitted infection like gonorrhea or chlamydia. Yeast doesn't usually have a smell. It could have a little bit of a yeasty smell to it. Bacterial vaginosis can have a fishy odor. But there are certainly some infections that can cause an acute or an abrupt change in your vaginal odor. So if you do notice a change and you're worried about an infection, not necessarily sexually related, it could be any sort of natural process that just causes an infection in your vagina, then it's worth talking to a doctor. Question number 3. I clean my vagina area with water, sometimes body wash, but only on the outside. Very good. And I still have discharge and a smell every day. I'm afraid to have sex because of it. I'm afraid my partner will think I'm disgusting and think that I'm dirty. I hope your partner doesn't. So someone who's new to vaginas might not understand the discharge and natural odor that can happen down there. And that would be maybe the one partner I could give an excuse or a pass to. Other than that, your partner should accept every part of your body. And you're doing everything right. Cleaning, don't scrub inside the vagina, washing the outside area, and the vulva is what it's called, but the outside of the vaginal area, perfectly fine. Don't over scrub, and know that you're normal, and it's okay. If you have a partner that doesn't like your vaginal smell, they can find a new vagina. That's what I have to say about that. Question number 4. Hey, could you talk about how to get rid of vaginal odors, or what products for vaginal odors would you use? Okay, so there are a lot of products on the market that play to people's insecurities about their vaginal odor and vaginal discharge. Don't buy into it. For the most part, inserting anything into the vagina can cause a disruption in the natural composition of the environment. So it can mess with some of the good bacteria, it can mess with the yeast, with the exception of like a tampon or a penis or a sex toy intermittently. Don't put any product in your vagina, especially with the intent to make the smell different or make the discharge different. It's just not going to help for the most part, which is why I do not recommend across the board for anybody a different thing other than just letting your vagina be. Now, that being said, the previous question they mentioned that washing outside of the vagina, so don't wash inside of the vagina. that can cause some disruption in the good bacteria and the yeast that live there and cause smell and discharge to get worse. Another thing you can do is get checked regularly for sexually transmitted infections, because those can affect your discharge and your odor. And lastly, let things breathe down there. I doubt you're wearing leather every day, but if you are, don't. Make sure you're wearing a nice, breathable cotton underwear, and let things just air out. Don't wear synthetic materials down there often, but having a nice breeze, having airflow, perfect. And those are really the best things to do for the vagina. So love it. It's doing a lot of work for you. Keeping things clean down there, keeping an infection out. It's doing a good job. It just has some discharge and a little bit of smell. And question number 5. My vagina has a strong fishy smell and a yellow colored discharge. Is that normal? This would be one that I would be concerned for bacterial vaginosis. And maybe not. If it's normal for you, then this could be your normal discharge. But if it's a change in your discharge, I would be concerned for bacterial vaginosis, or BV. Now, it's important to know that BV is not necessarily a sexually transmitted infection. It can happen to anybody regardless of how much sex they've had, or none at all. It can happen to someone who hasn't had sex. The thing to know is that it is an overgrowth, so some bacteria take over in the vagina and cause extra discharge and goop and smell, and that is easily treated with an antibiotic from the doctor's office. So it's easily tested, easily treated. So if you do notice a change or a super fishy smell, some itching down there, changes in the color of your discharge, then check with the doctor. Nothing to be embarrassed about. BV happens to a lot of people, and it's not necessarily related to sex, so nothing to be ashamed about. And that'll do it for this round of vaginal odor questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.